sepsis. You've probably heard the word, especially in hospitals, and you know it's serious. But what is it, really? See, it's not just about having an infection. It's about the body's absolutely chaotic, life-threatening overreaction to that infection. And understanding that overreaction, well, that's the key to stopping it dead in its tracks.
And just to give you a sense of how serious we're talking, get this. 1 out of every 3 patients who dies in a hospital has sepsis. Let that sink in. That is a staggering number, and it tells you exactly why recognizing this early and acting fast isn't just important, it is literally everything.
So what's the official definition? Well, the latest international consensus calls it life-threatening organ dysfunction caused by a dysregulated host response to infection. The key words there are dysregulated host response. It means the infection is just the trigger. The real damage, the thing that starts shutting down your organs, comes from your own immune system going completely haywire.
So here's what we're going to cover. We'll start with what sepsis actually is. Then we'll dive into the body's wild overreaction. We'll talk about spotting the crucial red flags, why every single second counts, and then we'll look at the nursing care plan, the absolute front line in this fight.
All right. First up, you have to understand that sepsis isn't just a single thing. Think of it more like a spectrum, a progression that can move from something manageable to a full-blown medical crisis. Each stage is a step up in just how badly the organs are failing. So let's clear up some of the lingo. You got sepsis. That's the organ dysfunction we talked about. Now, you used to hear the term severe sepsis, but that's kind of been phased out. The most critical stage, the one we really fear, is septic shock. This is when things are dire. It's defined by 2 main things. Blood pressure that's so low you need powerful drugs called vasopressors just to keep it from bottoming out, and a high lactate level in the blood, which is a screaming signal that the body's cells are starving for oxygen. So how does a common infection suddenly spiral into this system-wide chaos? It all comes down to the pathophysiology. It's a devastating chain reaction where the body's own defense systems become the enemy. Okay, so here's the play-by-play of the body turning on itself. First, some kind of bug gets in. The immune system hits the panic button and unleashes a flood of inflammatory chemicals. These chemicals cause blood vessels all over the body to widen, which makes blood pressure plummet. They also make your capillaries leaky, so fluid just pours out into your tissues. As if that's not bad enough, the clotting system goes haywire and starts forming tiny clots everywhere, blocking blood flow even more. The end result? A catastrophic drop in oxygen getting to your vital organs, which leads directly to them failing. Now, all that internal chaos, it sends out some pretty clear warning signs. And because sepsis moves so incredibly fast, spotting those signs early is probably the single most powerful tool we have. The real challenge is catching it before it's too late. So that brings us to the big question, right? How do you actually spot sepsis early? Well, clinicians have some key criteria and bedside clues they look for that basically scream, this body is in serious distress. For a long time, the classic tool was the SIRS criteria. SIRS stands for Systemic Inflammatory Response Syndrome. It looks for a weird temperature, either a high fever or being really cold, a heart rate over 90, breathing fast, and a wacky white blood cell count. If you have 2 or more of those, it's a huge sign of inflammation. The only problem is, it's not very specific. It just tells you the body is inflamed, but it doesn't tell you why. That's why now there's a much simpler, faster tool called the Q-SOFA score. You can do this right at the bedside. It looks for just 3 things: breathing fast, any change in mental status like new confusion, and a low blood pressure. If a patient with an infection has 2 or more of these, that is a massive red flag. It means they're at a much higher risk, and you need to act immediately. And once those red flags go up, it is a full-on race against the clock. I'm not kidding. For every single hour that treatment is delayed, the risk of death goes up and up. This isn't just urgent, it's a true medical emergency. I mean, this quote from the Surviving Sepsis Campaign guidelines says it all. There's no waiting around. There is no, let's watch and see. The only response is immediate, aggressive action, period. And this is where having a clear, standardized game plan becomes an absolute lifesaver. Hospitals use these things called clinical pathways. They're basically roadmaps that guide doctors and nurses from the very first suspicion of sepsis all the way through managing septic shock with clear, time-sensitive steps. Okay, so in the first 3 hours, there's a checklist of things that have to get done. We call it the 3-hour bundle. First, measure the lactate level to see if the tissues are starved for oxygen. Next, get blood cultures, and this is critical, before you give antibiotics, so you know exactly what bug you're fighting. Then you immediately hit them with powerful, broad-spectrum antibiotics and start a big, fast infusion of IV fluids to get that blood pressure up.
Now, what if after all those fluids, the patient's blood pressure is still dangerously low? That's when the 6-hour bundle kicks in. This is when you start those vasopressor drugs to squeeze the blood vessels and force the pressure up. At the same time, you're constantly reassessing how much fluid they have on board, and you're rechecking that lactate level to see if any of this is actually working. So, we've talked about all these protocols and bundles, but who's actually making it all happen on the ground? We're talking about the frontline healthcare team. And right at the heart of that team, playing an absolutely essential role, is the nurse. This quote just nails it. Nurses are the ones at the bedside, 24/7. Their sharp assessment skills are what catch those first subtle signs that something's wrong, and they are the ones who put these life-saving plans into motion. A nursing care plan is all about priorities. For a patient with active sepsis, the focus is on the problems happening right now. That means managing the low fluid volume from those leaky vessels, fixing the poor tissue perfusion, supporting their breathing as the lungs start to struggle, getting the fever under control, and, of course, helping the patient and their terrified family understand what's going on. But it's not just about fighting the fire that's burning right now. A great nurse is always looking ahead, trying to prevent the next disaster. And with sepsis, the two biggest risks are sliding into full-blown septic shock and the heart muscle starting to fail. That requires nonstop, proactive monitoring. And every single one of these nursing actions has a clear why behind it. Constant monitoring, that's to catch any decline the second it happens. Giving fluids and meds, that directly fights the infection and failing circulation. Making sure they get enough oxygen, that helps prevent severe lung damage. And strict infection control is all about not adding any new problems into the mix. Finally, education is crucial for getting the patient and family ready for a safe recovery. So when you boil it all down, the message is incredibly simple and incredibly clear. When it comes to sepsis, speed and strategy are what separate recovery from tragedy. Early recognition, followed by fast, protocol-driven treatment, that's what saves lives. Look, sepsis is a formidable enemy. There's no doubt about it. But it can be beaten. Understanding the signs, the urgency, and the right response is a responsibility not just for doctors and nurses, but really for all of us. Because knowing what to look for in a friend, a family member, or even yourself could one day make all the difference. So the question is, are you prepared to act?